The world might feel a bit more chaotic and a bit more divided. It's easy to forget sometimes that there are constants. Your home's still your home, your family's still your family, and all the structures of our society are still there to look after you if you need it.
Here we go. George's recess.
Adult male, code red trauma, 10 minutes.
Activate the helipad.
There's been an explosion on a building site.
Heart rate 200.
Open your eyes, open your eyes.
Imagine having to work here.
Hello, Annie, can I help?
St George's, London.
It's all gonna kick off now.
One of Britain's busiest A&E departments.
Are we ready to roll?
Carry on CPR.
Oh, goodness me, it's all happening, isn't it?
We need to fix that, or you won't survive.
Is it?
A place where life,
Would you say I was fit, Doctor? Honestly, I think I'm quite fit.
love,
You are my everything. I love you, and it's okay.
and loss
Oh, Mum. I'm so sorry.
unfold every single day.
For every bad thing that you see, there is something equally wonderful out there.
Filmed across one 24-hour period, these are the stories of a nation and its health service.
I thought I was going to die.
You're definitely not going to die. You've got too many good doctors and nurses here.
When people experience really significant illness or injuries, we see people pull together, we see relationships get stronger, and we see people reflect on what really is the most important things in their life.
Whatever happens, it's going to be okay.
I love you.
Love you too.
Mum was 11 when the war broke out. You used to hear the bombs all the time. Must have been absolutely terrifying. They had an Anderson shelter in the garden. Because it was in the East End, it was near the docks. And the docks were getting bombed so badly that obviously a lot of the bombs were dropping in residential areas as well. A school was bombed with children in it. A few of her friends were killed. I think growing up like that makes you more resilient. In the end, you're probably not scared of anything. I think it made her quite tough.
Hello, any recess? Yep. Yeah. Okay. So did she have a fall and she has a fracture?
A 91-year-old woman is being rushed to St George's after falling at home.
I just need ATA. 10 to 12. Thank you, bye-bye. Adult female trauma call, ETA 10 minutes. 91-year-old female fell from standing with a queer mid-shaft femur fracture.
Oh, God. When an elderly person falls, you're much more worried about them falling because they can do so much more damage. And because their bones are much more brittle compared to a younger person, they're more prone to fractures, head injuries, long bone fractures. There is a risk of bleeding. It can be life-threatening.
The woman's daughter is travelling with her in the ambulance.
She called me up saying she wanted to go to the toilet. The next thing I know, there's a crash. She sort of fell into the hall. I picked her up, put her on a chair, and she said she wanted her breakfast. I hadn't even got down the stairs, and there was a big crash again. She'd fallen in such a weird position. She was sort of sitting on the back of her heels. I said, we've got to call an ambulance. When the paramedics arrived, they said she's got to go to hospital. Then they've realised that there's no way they can get her down the stairs. In the end, they had to lift her over the banisters. Took them an hour to get her out into the ambulance. I just didn't realise how serious it was. I was terrified.
Ready, steady, go.
Sorry, Iris. This is Iris. Iris is a 91-year-old female. She had a fall in the bathroom. Daughter picked her up, noticed that she couldn't stand very well, taken her back to the bedroom. Had another fall, gone back on her heels and fallen quite awkwardly. We've arrived on scene. Her right femur was protruding, so we've traction splitted it. She's on warfarin.
My heart always sinks when I see an elderly patient come in with a major bone fracture. All I'm thinking about is rehabilitation. How long is this going to take for them? Is this going to strip them of their independence? How long are they going to be in hospital for? You know, those are the main things that run through my mind. I'm Elizabeth, I'm one of the nurses. We're just going to take this board out from underneath you, okay, and get you a bit more comfortable, okay?
Slowly,
I'm sorry, I'm sorry.
And the same on the other side. Sorry. Is it your right femur?
We're all done, we're all done.
Iris, my name is Tamer, I'm one of the doctors. We'll check you from head to toe, see what injuries you have, okay? Do you have any neck pain?
No.
Okay, good. Do you have any chest pain?
No.
Okay. Kendrick splint on the right leg with a query femoral fracture, bilateral leg redness. It's not hot, and there is no obvious deformity on the left side.
Temperature's 37.5.
Excellent. And pupils equally reactive, 2. All right. I'll think we'll scan her head to pelvis.
Let's put this down. Let's take this one off. Thank you. Ooh, I'm sorry. Where is the pain?
It's pain down your leg.
Down your leg, I'm sorry. We'll get you some stronger painkillers, okay?
Oh, yeah, please.
The thing I admire about Mum most is she gets on with things, she's resilient. She really doesn't complain about much at all.
Right, so we're going to get you around for a scan now, okay?
Yeah. So, seeing her so ill was pretty awful. I did worry that she may not survive.
Right, we're going to slide you across now, Iris, okay?
Ready, straight, slide.
I'm sorry, I'm sorry, I'm sorry.
91-year-old Iris is undergoing an emergency CT scan after falling at home. Doctors are concerned she may have fractured her femur.
Mum was born in Bow. She was one of 11 children. The house Mum grew up in, most of the children shared a bed, like 3 at the top and 3 at the bottom. No fridge, no washing machine, no central heating, and no bathroom and no indoor toilet.
You just follow the breathing instructions, it will tell you what to do, okay?
The war lasted 6 years. She got older and she went to work. She went to work in the rag trade. And you made money for the family. She worked for small companies and she also worked for CNA. Because she was in the rag trade, she could make all her own clothes. So any of the up-to-date fashions, she couldn't afford to buy them, so she'd just copy them and make them.
Breathe in and hold your breath.
She met my dad in the local town hall, which is where most people met at dances. He was a docker in the London docks. He worked really hard. In those days, everything was carried on your back, so he was strong. And she said he was quite handsome, and I think a lot of the girls were after him, but I don't think my mum was having any of it. They got married in 1952. It was a big wedding. Mum had a beautiful dress. She borrowed it from somebody, and it was fabulous. They were very close. Just rubbed along really well together. They were really happy. But it all changed.
Oh yeah, that's broken. They're both broken. They're both broken. Are you being... Really? Oh my goodness. Oh no. Oh, that is really sad. She's not going to survive this. Breaking one femur in an elderly patient, you know, you start to think this is definitely life-changing and life-altering. Breaking 2 femurs, the risk essentially doubles. You start to wonder whether this is going to be a survivable injury or not.
I'm so lucky that it wasn't that machine, the one with the big blade. And The hummus one? Oh my God, you'd have no hand, no arm. It had all been gone. Every time it would have chopped something else off, your arm would have been going down like... Would
you still be with me?
Boy, I'm joking.
22-year-old Elijah is in A&E after slicing his finger in a kebab machine.
Let me see the top bit now. Is it still... Is there more blood?
I can feel it. I can feel the blood rushing when I do that.
But listen, if your finger needs stitches, Elijah...
I'm doing it, no.
Just listen to me. Listen, it gets infected. Then you have no finger.
Elijah.
That's your name, bro. I'm coming with you. Hi. Hello. Come through.
Please have a seat. I'm Becky. I'm one of the nurse practitioners. Nice to meet you.
Keisha, Becky.
Oh my God, yeah.
Hi.
Hiya.
So, what happened to your finger? I heard a story about a...
Kebab machine.
Oh, is that what it is? OK, so how come your finger got caught in it?
I put my finger in it.
You put your finger in it voluntarily?
I was cleaning it.
OK.
And then there was certain parts you got to take out.
OK.
So I put the machine on.
OK.
Pressed the pedal, took my finger.
That'll do it.
Yeah.
Oh, bless you. OK, so can we get you up onto the bed? Is that OK? So we can have a little look? And how are you up to date with your immunisations, like your tetanus and things like that?
Yeah. I don't want to see it.
It's all right.
I do, but I don't.
Just gonna have a little peek. What led you to turn it on while your finger was in it?
Because the machine weren't...
That's the biggest question I'm dying to ask.
Because there was something in it, it weren't coming out.
Oh, you're like trying to push it through, you mean?
Yeah, to come out.
Are you his girlfriend? Does he often put his hands in the machine?
No.
I'm going to try my very best not to hurt you. Well, we all do things occasionally that we regret.
Oh.
Sorry, mate. OK.
Is my finger still in contact?
It is still attached.
So it's not broken?
Well, I don't know if it's broken or not. We'll have to send you for an X-ray. Can I just check with you? Can you feel me touching the end of it?
Yes,
you feel the skin,
yes,
yeah?
Yes.
And what about on that side? 100%?
It feels numb.
Numb, OK. What about here?
Yeah, I can feel it.
What about there?
It feels numb.
That top bit. OK. So, there are a few wounds there, OK, we need to look into. We're going to send you down for an X-ray. And then when you come back, I'm going to look at the wounds in a bit more detail.
I'm so happy it wasn't the other machine. Oh, my God.
If it was the other machine, you would have no hand left.
You're definitely not the first person to put their hand into a meat blender. And you will not be the last.
Hello, St. George A&E. Yeah, clear sepsis.
A 54-year-old woman is being rushed to St. George's with suspected sepsis. Dr. Sophie is on shift in resus.
Sepsis is the body's reaction to infection. It's sort of an overwhelming immune response. And sometimes your body can cope with it, and sometimes your body starts to fail to cope with it.
Adult female medical priority, ETA 10 minutes.
Left untreated, sepsis is life-threatening. It will kill you.
The woman's husband is travelling with her in the ambulance.
In the morning when she woke up, she was very unbalanced and she couldn't really walk properly. So I rang up the doctors. The doctors said, would it be all right if we waited until after surgery and they'd come and see Alison? Thankfully, it was one of the boys who said, we're not waiting for the doctor to come. I think Mum should go to hospital. When I called ambulance, I didn't realise how serious it really was.
Number 3, please.
Ready, steady, slide.
There you go, Alison. I'll sit you up again, my lovely.
There we go. Right.
My name's James, I'm one of the nurses.
Put this mask back on you, my love.
So, Alison has been unwell for about a week, but she's been kind of managing. This morning, she's deteriorated quite rapidly. Husband says she's really lethargic. He's not been able to get her out of bed, really, really drowsy.
I'm going to try and take some blood, is that all right?
She has a history of lung and brain CA. Which last chemo was November 2017.
38.6. She feels very well.
When someone has cancer, particularly if it spreads, they are more susceptible to infection.
All right, my love, sharp scratch.
We know that their immune system will not be working as it should, and that makes opportunistic infections more likely.
How you doing? Yeah?
And sometimes their immune system can completely fail.
She's had 5 lots of antibiotics, and lately it's got worse. She's been getting less and less mobile, more and more forgetful. She just didn't have any kind of energy, even to get up again. She just didn't have it. That's when we realised this is really serious now.
Doctors now have the preliminary results of Iris's CT scan after she fell at home earlier today.
Iris, you know they've put the thing on your leg here on this side. On your scan, it looks like you've broken both your legs.
Oh my goodness me, Mum. How the hell did you do that?
Both legs.
Oh my God.
Yeah.
You're in the wars, Mum. Yeah. You couldn't break just one. You had to break 2. You've done, yeah, you have. Okay. You've done a double whammy.
Won't be any football for a while.
No dancing.
No dancing, no.
When Mum and Dad first got married, they lived in his mother's house, just in one room. And then when me and my brother were born, all 4 of us lived there. They were building a lot of council properties, and my mum was on the waiting list. In the end, they were offered a council property in Wandsworth Common. So they thought, right, we're going to move to Wandsworth, which is what they did. Indoor toilet, a bath. It was luxury, absolute luxury. My dad was really funny, always making my mum laugh, but he made me and my brother laugh as well. He made everybody laugh. Everybody liked him. We were lucky, we had a really good childhood, happy childhood. But then our world shattered completely.
Iris's granddaughter, Lucy, has arrived at St George's.
Oh, no.
My granddaughter.
How are you?
Oh, don't.
Nan. What have you done?
I know. No fault. Trying to help yourself.
Just tell me what happened. You fell over.
Oh.
Don't remember?
I don't remember. I slipped off the chair.
So they're giving you loads of painkillers? Yeah? Was they nice, young men?
Oh, the ambulance people were lovely. There was 6 of them, wasn't there, Mum? 6.
6 of them in the room.
You ain't that heavy, are you?
No, but it's getting her over the banister.
They took me over the banister.
Oh, what? They took you over the banister?
They said, shut your eyes. I said, she's been through the blitz, that won't worry her. As we got older and left home, they decided to buy a tent and travel down to France, sometimes Italy, pack the car up and just drive over. They used to do that every year, and they used to love it. She was looking forward to retiring with Dad, but Dad still worked in the docks. By then he was the superintendent, so he was like really high up, and he was at Tilbury by this time in Essex.
Right, gonna give you one more antibiotic, and then we're gonna go for x-rays, okay?
So don't put me in the cupboard.
I don't think you'd fit in the cupboard, to be honest. I think the bed's a bit too big for the cupboard.
She'll be all right. That's what she does.
She'll be dancing. She'll be dancing.
You got to heal up so you can break it again, haven't you, Nan?
25th of November 1988 sticks in my mind. I'll never ever forget it. My dad went off to work as a normal day. Then later that morning, my mum got a knock on the door and it was my uncle, his older brother. And he just said, I've got some awful news. They were transporting cars in a container. The container was on the crane and something snapped and my dad pushed the foreman out of the way and it hit my dad. So he'd saved the man's life, but unfortunately lost his own. I think he broke virtually every bone in his body. 59 he was. Mum was absolutely devastated. She was sort of quite numb for quite a few months. She'd lived with my dad for nearly 40 years, so it was a big wrench for her. Just him not being there was just so hard for her.
Are you warm enough? Yeah? Good.
So what she had done is
CT scan,
CT,
yeah.
and now she's
Exactly.
having X-rays just on her legs.
You can come with us if you want. It's only around the corner.
Come on, let's go. Change the scenery. Oh. Oh, hi there.
Sorry, I forgot my socks today. Did you? That's horrible.
I might have a spare pair in my bag, hold on.
Why would you have the spare socks?
Let me just have a look, Beth, hold on.
I love it.
Emergency department, can I help you? I don't know, they're trainer socks.
My preferred type of sock.
There you go, they are clean. Do you want to see what's in my bag? No, honestly, look, it's a bit of deodorant, cotton buds, tights, spare pair of tights, spare pair of knickers, little sewing kit. If you split your trousers, I've sewn many an ambulance man's trousers and buttons back on. There's a little screwdriver in here as well for glasses. It's always got to be prepared, me. What else? Oh yeah, look. They do laugh at me, you know, when something happens. They all come to Jane.
Alison, how do you feel now?
I just feel very tired.
Tired. Do you feel like any chest pain or shortness of breath?
No.
Definitely give you some fluids and some antibiotics. And we should definitely do a chest x-ray.
Alison is in resus with a suspected chest infection.
Have you got any pain, Alison?
No.
Only one knee sitting next to her.
Yeah.
Okay, I'll rush up the antibiotics now.
You better say no.
No.
Oh well. Me and Alison met the first time at Eastfields Park, Croydon. I must have been 13 or 14. She asked me out, and I declined. Don't know why she thought I was cute, but she did. I used to be shy then.
Any allergies, my love?
Only me.
Only you.
We just went separate ways, and that was it.
You have 2 cannulas at the moment, one in each side. We're gonna give you the medication you need, some antibiotics.
I didn't see Alison for about 15 years. And then one day, Alison was standing by the bus stop. I was very attracted to her. You couldn't really not recognise her with her little freckles and her Albany hair. She didn't like the word ginger.
Just because your veins are quite fragile, so I want to keep them and see if both work all right.
But Alison was married and had 2 little boys. She seemed quite happy and content. I was single, and relationships was a bit hard, I suppose.
Al, you all right?
Years went by, and we kept bumping into each other. The last time we bumped into each other, that's when I found out she was a single lady again. I didn't want to sort of leave it for another 6 months or a year and just end up having the courage to ask her out. And she accepted.
Hold on, love. Okay.
We was together for about a year, and one afternoon, Alison asked me to marry her, and I said yes. But I wasn't expecting to get married to anyone, really. So, about half an hour later, I ended up having cold feet and going back on my word.
Do you want some cold water? You sure? You should be drinking, love. Just a little bit. Just a tiny drop.
I definitely felt guilty afterwards. I thought about it, and it must have been maybe a month afterwards, I thought I'll surprise Alison.
The medical team now have the results of Elijah's x-rays.
So, it's not like the bone hasn't snapped in two, however.
There's a however?
Unfortunately, there is a however. I'm really...
Is this little black shadow?
Well, see that little black shadow? So what that's telling me is that wound goes all the way down to the bone. So our next job is to basically have a little look and see how those fingers are flexing. Is that okay? I do need to put some local anaesthetic in, which is going to be a bit stingy.
So my heart is pumping right now.
You'll be okay.
So it is broken?
Yeah. You're not going to cry, are you?
I might do.
Please don't cry.
There you go. Get somebody nice to hold your hand.
Tell my mum I love her.
Elijah, you're not going to die. It's just to be silly.
I know, but anything can happen.
Let me just have a little look and then we're going to talk through
All right,
a
Becky.
few things. Is that okay?
You do your thing,
One
Becky.
step at a time.
Oh, my God.
You'll be fine.
Oh, that looks grim.
I mean, your finger's still on, so that's a positive. So what I need you to try and do for me is I want you to try and bend it. Great. Do as much as you can.
I can't.
Great.
I can't.
That's okay. You're doing really well. So we're gonna numb it now, okay?
Just don't look like that.
So probably best look the other way. Ready? Keep your hand nice and flat for me. Okay, first one coming now. Well done. Great, well done. Perfect. Sorry, mate. You are sweating. Did really well. Okay, we're gonna let that kick in, and that should hopefully go lovely and numb.
Give me my hand back, please.
Just rest that down. All right. Feel okay? Yeah? Good.
Iris, I've got you some yogurt now. Let's try and sit up and see if you can eat it. Tell me when to stop if it's too painful, okay?
Iris is waiting to be seen by orthopedic specialists after fracturing both her femur bones in a fall.
Quite difficult to do it yourself, Mum. You'll spill it everywhere.
All right.
Once my dad had passed, she didn't really know what to do with herself. She'd never been on her own. We suggested she go on a cruise. And it took quite a bit to sort of, for her to even think about it. Never been away on her own before. Anyway, she did. She went on the Canberra on a Mediterranean cruise. Got the best cabin. She went out and bought all new clothes. It was quite posh, the Canberra. She loved it.
You like the yogurt?
Yeah.
Good. They have more upstairs.
Then we said, right, my brother had immigrated to Australia. You've got to go to Australia. She said, oh, no, I can't do that. It's too far. I can't go on my own. She went and she thoroughly enjoyed it. She seemed to get more independent as she got older and got used to my dad not being there. I sort of admire her the way she got on in the end. Mum has always gotten through anything that's thrown at her. I don't think I could be ever as strong as she is, ever.
Doctors now have the full results of Iris's scans. They're concerned she may need emergency surgery.
She has bilateral lower limb edema, the distal femoral fractures. The left is more distal than the right.
A femur fracture will nearly always require surgery. It can be held in place for a few days by a cast, but majority of the time you'll need surgery to recover, but it can be life-threatening.
Hello, my name is Tamer. This is Sophie. She's
I'll tell you what,
she's
I'll
a
leave you
medical
to it and I'll just go and get the
Okay.
coffee. Yeah.
You are family.
I'm her daughter, it's my husband.
Hi. And is it you who found her in the toilet?
Well, we both did. We sat her in a chair and she said she wanted her breakfast.
I said to her, don't get
gets
up
up.
because you're going to fall. She's got this slide tilt chair and she's just gone zoom.
You've got both femurs fractured, and both fractures need an operation.
She's a bit deaf.
Yep.
Mum?
Yeah, no, I'm just explaining to you first
okay,
and then.
yeah. You've got both fractures on both legs and you will need an operation. You've got to have it and that's all there is to it, yeah.
Yeah.
I haven't said a word.
No, you'll be all right.
That's it.
Okay. Can I talk to you outside? Yeah. What's the prognosis for someone of that age?
We have to fix her.
Yeah,
We have to fix the
I know.
fracture because this is the main risk. Keeping a patient of her age in bed for a long time is slow death. Nothing more. I'm sorry to say this.
No, I know.
Again,
I
the
know.
operation is very risky.
Yeah.
And it needs to be done.
Yeah.
It needs to be done. We need to put her back on her feet as soon as possible. Keeping in mind that there are many risks and she can die.
Okie doke, let's go.
Iris will now be taken to a ward to await surgery on her legs.
Everybody thinks an operation will fix something, and there's always a risk with an operation. You know, there's risks of bleeding, risks of wounds not healing, risks of coming out with another infection, a blood clot. You know, you're trying to make somebody better, but at the same time, it could be that the patient doesn't survive from this.
So it's starting to get a bit tingly.
Yeah.
Good.
Nurses are preparing to treat Elijah's finger after he got it caught in a kebab machine at work.
We're going to have a little look and see if we can see what's going on, and then we're going to give it a clean, OK? The thing is with raw meat is it carries a lot of bacteria on it.
So it could get
So we need to
infected.
give it lots of washing.
Just let me know when you're done, innit?
Yeah, all right.
Thanks.
Don't worry. So one of your flexor tendons has been cut through, one of the strings that makes your fingers bend. It's fixable, but they need to fix it in theatre, so it's going to need an operation, OK? I'm just going to have a look in the top one. So what's happened on the top one is like an open joint. So where your bones meet, there's now communication from the outside world in. So this is another reason why we need to have it washed. So I think it's very likely that this might need to be done today. Okay. Just try not to tip the thing on you.
I'm definitely not using that machine again, though.
No, don't. I'm thoroughly recommending turning things off at the
It was
wall.
on.
You turned it on?
He turned it back on.
I turned it on. Because it weren't coming out, the machine, so I had to turn it on.
You do know your finger is made of meat, don't you?
I know that now.
You're so lucky you still got your finger in.
You don't have fingers made of steel. You just keep it hovering there for a second.
Don't cry.
I'm not going to
You look like you're gonna cry.
Not yet, anyways.
Me again. You're okay with penicillin, aren't you? Fab. So I've spoken to the plastic surgeons. They've got all of your details. They are very busy at the moment. I think it's quite likely that when the night team come on at 8, they'll probably come and see you. We'll get there. You've got someone at home to help you out at home. With your fingers all bandaged up.
I live for myself.
You're going to have to be official nurse.
I know.
All right, you can have it back.
Thanks.
It's like a, you know those big
Oh,
foam hands that you get at, like, football games.
Yeah, if you wouldn't mind moving over for just a minute or two, okay?
Doctors have ordered scans of Alison's chest to determine if she has an infection in her lungs.
Chin up nice and high. Okay, Alison, take a deep breath in. Hold your breath. And breathe out. Well done.
I proposed to Alison just before Christmas, and I thought I'll surprise her.
The doctors will be able to see that X-ray straight away.
Okay. All done. Thank you.
No worries.
To get her to come out, made a few little lies. First of all, I was going to Lidl's to do a bit of shopping. Oh no, I don't want to go to Lidl's. Going to Marks & Spencer's now. Oh, it's too expensive. Walked past Marks & Spencer's and walked to H. Samuel's and asked her to choose a ring. And she was absolutely gobsmacked. We got married the following summer. It was a really fantastic day. She looked absolutely incredible. I felt overwhelmed, overjoyed that me and Alison had a second chance. I was very proud that Alison was my wife. It was the best thing that could have happened to me. But I could never imagine how things could change so quick.
Some of the blood tests are back, so the white cell count, which is a marker of inflammation or infection, is high. But certainly the keeping with the fever and things like that certainly looks like infection. And I wanted to check from our notes. So is it brain cancer, or is it the tumour come from somewhere else and it's gone to the brain?
That's right. It's 2012. It's diagnosed the
Yep. Oh, fantastic.
chest.
And then you had some radiotherapy as well.
Yep.
And then chemotherapy as well.
Yeah.
This is an incredibly helpful letter.
Good. Back in 2012, Alison kept coughing. It didn't go away. So she had an X-ray. They noticed something, and she was diagnosed with lung cancer. I was gobsmacked because she's never smoked in her life.
I'm just going to listen to your chest, but stay as you are. I'll let you know if I want you to move.
Somehow, from her lungs, the cancer went to her brain. I was completely gutted and angry. But Alison took it in her stride.
And is there any pain when you breathe in? No. Okay, all right, thank you.
They operated about 2-3 weeks after she was diagnosed with brain cancer. The way she went into the theatre as if she wanted to get over and done with, which was quite reassuring, really.
Are you able to lean forward to me, just gently? Try to listen to your lungs around the back. If you feel too weak, I can... It's okay.
She was very scared, but at the same time, she was strong. I think she did put a very brave face on for me and for the two boys.
I'm going to gently feel your tummy. If there's any pain, just let me know, OK?
Alison was given the all clear a few months after her treatment, thinking that it could only shrink it, but it's gone, and even they were amazed it was gone. Me and Alison end up getting a nice caravan, spending time down in Worthing. We used to go for nice long walks along the beach. It used to be fantastic. Not a worry in the world.
Al, how are you feeling, love? Feeling a little bit better? Yeah? Oh, good.
I've had a quick look at the X-ray images. There's nothing obvious, there's no focus clearly of where an infection might be hiding. But either way, we're going to treat it as a chest infection, clearly the most likely source.
4 years later, she ended up having a seizure. It lasted a good 10 to 15 minutes. And she ended up going to the hospital. They took us into a room and told us the cancer in the brain had returned. It's come back. Our world was turned upside down again. That's when we realised that might not be a cure.
And so you're currently still having kind of hospice care, I gather. And sort of how's that going? What sort of anything changed? Anything new? Any plans in place? Or are you just sort of monitoring?
Just monitoring.
Monitoring, isn't it?
I suppose in a way, didn't really want to accept it, or just put it completely at the back of your mind and just try and carry on as normal as possible.
Have you had a cup of tea or anything like that?
I'm fine.
So I think your bed's come available.
Oh, right, she's staying in.
I thought, well, she'll be seen by the medics over there and then they'll decide.
Life itself is not always holidays and doing stuff, it's just being together and enjoying each other's company.
Alison will be taken to a ward, where doctors will continue to monitor and treat the infection in her lungs.
We were taken to one side by the consultant and said, you know, your mum's very ill, she's old, and it doesn't always work out very well with this sort of operation. And I think they were worried on all sorts of levels. I mean, the consultant did say, well, you know, anything could happen. And it was a 6.5-hour operation that she pulled through. She's got 9 lives, I'm sure she has. She's got another few to go. She lost nearly 2 stone in hospital, but since she's been in the home, she's eating, she likes their food. She says their roast beef melts in her mouth. Because she's got no teeth, so it's a good job it does. Yeah, she really enjoys it there, she loves it. I'm happy that she's happy, and if she's happy, all's right with the world.
Alison was a very strong person, but in the end, she had enough, and she was ready to go. Alison was the one. I was very, very lucky. It was special.
it.